We are dealing with a very, very rotten government that is stealing with the left hand, stealing with the right hand, stealing with the left leg, stealing with the right leg, stealing with the head, stealing in all manner of ways.
Billions of shillings, the lifeblood of Kenya's public services, are flowing through a network of shadowy farms, all tied to President William Ruto's most ambitious projects.
That the Ruto government is fully behind it, and Ruto personally is responsible because yesterday at the funeral he claimed that he's not a fool to commit the government to buy software at a cost of 104 billion, or for more than 100 billion. But the facts speak a different story. They have done that, so they know very well what they have done, but because they have been exposed, they are trying to play with our minds.
These are initiatives designed to streamline revenue collection, taxes, and levies, projects meant to benefit every Kenyan, but instead, are they enriching a select few?
We are being scammed by people who know what they are doing. It's not accidental. The share is not. It's not that the SHIF is not working. It's an extortion scheme. It's supposed to get money out of Kenyans and transfer that money out of the Kenyan economy.
According to Kenyans, these crucial financial systems are not managed by state institutions as one would expect, but by private companies.
Only people for whom SHA is working are the ones who are getting these commissions, the 2.5% from my monthly contribution. You have told us that they have to be paid on a daily basis. And yet the facilities themselves do not get similar treatment when they ask for reimbursements for their claims, Madam Koweji. So can we, with finality, say something? Can we take drastic action? Because some of us do not mind being a bit rash if we are going to do something that is in the best interest of the country. Can we agree before this committee that we want to terminate that contract, and what are going to be the consequences? Because you can't continue to allow people to enjoy proceeds of crime. Let's just declare this SHA and SHIF a criminal enterprise, and we'll close it today.
Every report that
sensitive public data is in private hands. The Auditor General struggles to track the movement of these funds, leading to billions of shillings in revenue simply vanishing unaccounted for. At the heart of this controversy is the Social Health Insurance Fund, or SHIF, expected to handle a staggering 104 billion shillings annually, funds meant to ensure healthcare for all. Yet the government's own pay bill number collects over 900 million shillings daily. Where is all this money going?
Every Kenyan is asking. The Auditor General has submitted a report to Parliament about the Social Health Authority procurement of systems. The amounts of money involved are crazy. 104 billion Kenya shillings. In your report, you have listed a litany of transgressions of the law, the Constitution, the Procurement Act, the PFM Act. You have said management was in breach of law. In several instances, you've said it almost 10 times. What these commentators on Radio in the Morning were asking, now that the Auditor General has said management is in breach of law, we are waiting for Parliament to go and whitewash the report. OAG, I can assure you that if that report is to come before this committee, we are not going to whitewash it. If you have gone to the ground, you have asked for documents, and you have found that 104 billion was spent.
Kenyans are now learning that Webmasters Kenya Limited developed the e-citizen platform, the gateway to so many government services. But the government also collaborates with MPESA Flow Limited and Olive Tree Limited. Details about these firms are closely guarded. Who owns them? Who benefit from their involvement?
Solidarity forever. Solidarity. We are really concerned that the agreement between SHA and our teams, that is the COC and the Ministry of Health, is not bearing any fruit. We are really concerned that up to now our members are not able to do pre-authorization for SHA.
The problem with the Social Health Authority is the secretariat, the management of the Social Health Authority. It's not the law, it's not the other things, it is the management. And that is why we continue to call for the disbandment of the management of Social Health Authority, and we bring in Kenyans. We have many Kenyans who are intelligent enough and who have the goodwill and who understand that the Social Health Authority is supposed to facilitate that we can be able to achieve the universal health coverage.
Deliberately, the government have chosen to work with a system that continues systematically to fail. Every time on Friday, Thursday, there is several facilities that you cannot seek services. And those are deliberate issues, and issues which are administrative and need to be sorted and not to be repeated. But since last year, October, when we rolled out this SHA, we have continued to actually appreciate, see this problem repeatedly, and the Kenyan complaining they are not taken serious. You know, let me say that it cannot be said that you go to arrest a patient who came to complain, giving you feedback on where you need to improve, and you arrest that patient. It is a clear demonstration that you have no...
The Ministry of Health claims to have obtained legal clearance from the Attorney General, assuring value for money.
Where I pay attention to Article 296. So already I have concluded that there was no effectiveness or lawfulness in the use of public resources under those matters. Then I have the third section that now looks inward into the entity in terms of governance, in terms of risk management, in terms of the internal controls the honorable member is raising. And I also give a conclusion. And I said these matters have affected internal controls, or internal controls are not being followed. The governance structure has problems. There is no risk management. And hence, then we have all these issues happening under effectiveness and under the opinion matters fiscal. So my report is very clear on that I have already pronounced myself on the issues that were not lawful and that were not effective.
But even Prime Cabinet Secretary Musalia Mudavadi admits the health fund is struggling.
Our people katika mambo ya hospitali, SHA is still not yet perfect. The social health arrangement is not perfect. Haijakuwa sambamba kabisa. Bado kuna matatizo. Mimi kama mmoja ambaye yuko kwa serikali, sitaki kuficha niseme everything is all right. I would be lying. Na watu wa mamlaka walinifunza hapa kwa soko, hata kama ni mbaya tuambie tu, lakini usitudanganye. Kwa hivyo kuna shida, matatizo hapa na pale kwa health sector. Lakini kutatua sio kutoroka na kusimama kwa jukwaa na kutoa sarakasi, hapana. Let us find solutions.
Days after that admission, private and mission hospitals pulled out of the scheme, citing over 30 billion shillings in unpaid claims. Patients are being turned away. Public trust is eroding. Are private interests being served at the expense of the Kenyan people? Health Cabinet Secretary Deborah Barasa, under pressure, seemed to deflect questions.
Yeah. Do I need to get a governor to come and justify that the SHA was proper? And yet you are the one with the constitutional mandate to tell us whether resources have been used lawfully and efficiently. And so we must have this conversation. Once the Auditor General has said that the procurement of 104 billion of systems under SHA violated Article 227 of the Constitution of Kenya, violated the Procurement and Assets Disposal Act, violated the PFM Act, was not value for money. There were clauses and provisions in there that were not competitive. People were being locked in. There was a software as a service arrangement, which then does not confer ownership of the system to the citizens of Kenya. And you have said management is in breach of law. What else are we waiting for? Shouldn't we then be asking for administrative action for people to be fired, for people to be investigated, for people to be arraigned in court. And those people are not just the people on the government of Kenya side, but including the system vendors. If there's a breach, then perhaps there are two parties to it.
According to CS Mbadi, there is no country that has implemented universal health coverage without issues around it. We cannot afford to lose SHA. It is the best system for this country.
Yes, but those challenges must be dealt with within a period of time so that the system works. We cannot afford to lose this. We cannot afford to lose this system. This system is the best for this country, especially with these challenges around some of the health programs that were being supported by USAID. We need a system that caters for the vulnerable of the society. And so mine was, Mr. Speaker, just largely to agree with Honorable Alwan, and I've taken note of your suggestion and advice.
As politicians debate and private interest profit, the average Kenyan is left to wonder, is this flagship program a pathway to better healthcare or a pathway to prosperity for a select few, shrouded in secrecy? The questions remain, the answers are desperately needed. News from Maisha TV. My name is Joy Madoya.